different credentials, whether we're doing inpatient, outpatient, risk adjustment, compliance, auditing, and et cetera, et cetera. A question had come in recently into the student forum about using the index. And so tonight we're going to talk about using the index for all the code sets. There are several code sets that we use for different reasons, depending on what you do as a coder. And so I'm going to kind of highlight all of them for you. The index is something that you learn really quickly when you're taking a course in medical coding and billing. It is I started to say the bread and butter of what we do, meaning how to look up a code. It's the basic way you go and look up a code. Every code set has an index. Not every code set manual is set up the same though, but every single one of them has an index. When you're talking about ICD-10 CM, which I should look there and say that should not be that should be a hyphen and not a equal sign there. The ICD-10 CM has an index and then it has a tabular. CPT has an index and they don't really call it a tabular. It's a list of codes. HCPCS has an index, but it's not really called a tabular per se. And ICD-10 PCS is a very unique code set. It has an index, but then it's got tables in what we would call the tabular portion that has the codes in alphanumeric order for the different code sets. Whereas PCS is a little bit different, as it's not alphanumeric per se. The tables are set up in categories and then they end up being somewhat alphanumeric. It would take a long time to explain that, but if you're interested in inpatient, it is something that we would talk about in there. So I'm going to highlight a little bit about each of the code sets index. Again, referring to the index, it is the starting point. So when someone is new to coding and maybe they don't have a clinical background and they want to know how the manual is set up, which the manual is your instruction book for your different code sets, if you need to know the verbiage. The index and then what I would say is the tabular, the alphanumeric section, think of it as a dictionary, and then think of the tabular as a telephone book. Okay, so if you're looking up a word in the dictionary, you want to know how to spell a word, you have to know at least partially how to spell the word, right? Or maybe you're just wanting to get the definition. Let's say you're wanting to get the definition. And so in the index, it would be like saying, I want to know how to spell diagnosis, or I want to know what diagnosis means. So you would go to the D's, then you would go to the DI, then the DIA, then the DIAG, until you find, and then you would scroll down and you see that it said diagnosis, okay? But let's say it's like even like a telephone book is set up that way too. Say you want to call your friend Mary Martin, and you go in and you look at the Martins, right? And then you find a Mary Martin, a Marie Martin, and an M Martin, okay? So you have to decide, well, which one is it? It's not Marie, it's Mary. So we can throw out Marie, but you still have an M Martin, and that could stand for Marie or Melvin. It could be anything. So what do? Then you look at the address and say, my friend Mary Martin lives on First Street. Okay, and then you would look, and one lives on First Street, and let's say M Martin lives on First Street, but the one that's listed as Mary Martin is actually on Chippewa Street. It's like, okay, and then you're getting to a higher specificity, right, to find the phone number of the person that you're wanting. And that's how the index really works, except for that let's say you picked that which Martin it was, and let's say it was M. Martin on First Street, which was your friend Mary, then it would say go to page 34. Okay, now this is not the way the telephone book works, and if you're relatively young, you may not even use a telephone book anymore, because now everybody just looks it up on the computer, right? Or you go on your phone. So if that were the case, let's say we wanted to get more information about M. Martin, our friend on First Street, and let's say we had a book that would do that for us. It says go to page 34. So then we would go to page 34, and then it would give you all the information about M. Martin on First Street. That M. Martin is single. That's why she uses M. Martin. She lives on First Street, but she actually lives on 104 First Street, and she's lived there for 5 years. So it gives you a higher specificity there on that page. That's how the index and the code sets work, where you look up the information in the index. However, the key is you have to know what keyword to look up in the index. So this concept of using an index and then moving to the tabular, that's easy, right? Because you've looked up a word in the dictionary, or you've looked up a word in a telephone book, a name or anything like that, or just used an index for a textbook, then you know how to use the index. The hard part is knowing the word to look up in the index to get you to the proper page. And so we're going to talk a little bit about that. And there's a learning curve on those, because the code sets are a little bit different. Again, if you are new to our lectures and our webinars, this will be a student webinar, so it'll be pretty basic, but it might be a good review if you're not familiar with one of the code sets. Maybe you are a coder already, but you're really curious about ICD and PCS, which is in-page procedures. Well, I'll tell you how to use their index. So let's start with the different code sets. We have ICD-10 CM, which is our diagnosis code set. That is one of the most widely used code sets because everything needs a diagnosis. It is how we are reimbursed, but reimbursement in outpatient is not based on diagnosis. It gives us medical necessity. In outpatient, it's based on procedures, what you do to the patient, but you have to be able to show medical necessity with a diagnosis. So ICD-10, you'll use it for all of your coding, whether you're doing inpatient, outpatient specialties across the board, you will use ICD-10 CM. And to me, it's my favorite code set. I really enjoy it. And I like the whole diagnosis and the disease process. And so I talk about that all the time. So CPT is a different code set. Let me tell you one more thing about ICD-10. ICD-10 CM is also an open code set. So it's not really owned per se by anybody like CPT, which is owned by the AMA. Okay, so there's copyright on the CPT manual. When you get a CPT manual, say you order your 2020 CPT manuals, it will look like everybody else's CPT manual. So if you go to page 114, you're looking at the same page as everybody else. Whereas with ICD-10 CM, with HCPCS and PCS, there's no copyright. So that means whichever publisher you get, if you're using Elsevier's Carol Buck, or if you're using the AAPC's one, or if you're using Optum, and there's just a bunch of them out there, whichever manual you're using, whichever publisher, then it'll be a little bit different. However, the index is exactly the same. Okay, the same content, it just may be formatted just slightly different, but there still will be an index and there'll be a tabular. Okay, but maybe in your index, there's lines showing indents, or there's extra content and more graphics and pictures in the tabular. Because again, all the code sets are free to be creative with them, except for CPT, because that's owned by the AMA. Now let's go back to talking about CPT. That is our procedures code set for outpatient. And outpatient, facility outpatient uses it as well, but it's what we do to the patient. So this is how outpatient is reimbursed. If you're going to clean the cerumen in somebody's ears because they're having trouble hearing, and the doctor looks and sees that there's an impaction of cerumen, which is just a big word for earwax, in the ear, then they will clean out the earwax, which is a procedure. It's something they're doing to the patient. Why are they doing the procedure? Because the diagnosis is an impaction of cerumen. Okay. HCPCS is a little bit different. You do get tested on HCPCS with your different credentials if it's outpatient, but it's really only used for Medicare patients. It's almost like a supplemental code set. And it's, when I think of it, it's mostly supplies. Now it's more than supplies, and I'm going to show you an example about ambulance. It's services and other things that Medicare patients would have provided for them. But it still has an index, and it still has the tabular setup the same way. The code itself doesn't look like a CPT code, and it doesn't look like an ICD code, right? It will have a letter, and then it will have numbers after it. Whereas your ICD-10 code set, it's set up with 2 numbers, a decimal, and then up to 3 more characters, which could be letters or numbers. Predominantly it's numbers, and then the 7th, it's 7 characters, might be an A at the end for initial visit. Okay. CPT is just numbers, only numbers, and then HCPCS will have like a J0010, and that would be like an injection code or something that we're injecting into the patient. But it's also supplies, and I've got some examples because we're going to go over each one of these individually. ICD-10 PCS is a relatively new code set. So when we went from ICD-9 CM to ICD-10 CM. In the past, ICD-9 had all the procedure codes for inpatient as volume 3 in your ICD-9 manual. Okay, but when they went to ICD-10, they implemented not only the new code set for diagnoses, but the new code set for inpatient procedures. And they named it ICD-10 PCS, which is procedural coding system. And it's used for inpatient coding. Now, there is some, maybe some ambulatory surgeries maybe might use PCS, but it is a fabulous code set for procedures. It's much easier to use than CPT. It doesn't have a copyright on it. So your manuals can be very creative and again have graphics and all kinds of additional content in it. It's a much easier to use code set, but it is drastically different than anything you've ever seen in a code set before, because you still have your index, your keywords that you look up, and it tells you where to go, but it's done up on tables. Everything is, I picture them in my head like a drop down on a computer. So it gives you your keyword and it says go to, you know, this particular first 2 characters, and then you flip in there just like you were looking up in your dictionary or whatever you can see at the top. So you find your table, and it might be 032, okay, which would be an obstetric procedure code. And then what you're going to do is you look at the table, and it's not a graph, it's a table, and then you follow along to fill up each one of your characters, and there's like a drop down, although it's not a physical drop down because it's a table, but it has a list. And once you fill that, you know, your 4th character, then you go to your 5th character and you look, and then you go to your 6th character and you look, and there's a list. it is an amazing code set. If you want to know more about ICD-10 PCS, we do have additional training and information about that on our YouTube channel, Medical Coding Cert, and I urge you to go and look at those. Again, I love ICD-10 PCS. It blows CPT out of the water. It is multi-axial. It won't run out of characters, and it's just all around better. And I project, or I say, mark my words, in the next 5 years, I will see a real big, I think we'll see a real big push to replace CPT, because it's that much better to use than CPT. CPT is outdated and cannot be expanded. So again, your index is your starting point for all of these manuals. And most people get confused when they're starting out on those key words. So we're going to talk about each one of the code sets individually. We're going to start with ICD-10-CM, and it looks like today when I was making my graphics, look, there's not even an indent there. It should have say manual index and there be a space. I don't know what it is. Maybe I needed to wear my new glasses or something, but forgive me for not having a little space in there. If you are one of our students, that means you have access probably to our CCO club. The slide deck will be available to you, or if you're part of the CCO club. If you are not and you're just watching us in the live stream, feel free to go check out cco.us/club, and then you'll get you can join and get access to this additional content and be able to watch this again and again. So starting with ICD-10-CM, it is all about what's wrong with the patient. Okay, so all of these are diagnoses. So let's talk about how we would look them up. If you want to look up the uh, uh, diagnosis of appendicitis, that it's an inflammation, right? It's an itis, that's inflammation. And we know it's the appendix. It's a pretty common diagnosis that people across the board, even, lay people, know what appendicitis is. You hear it in movies and so on and so forth, right? Your appendix, which my daughter was telling me the other day, for so long, scientists didn't know what our appendix was used for. What's the purpose of our appendix? And if you don't know where your appendix is, I urge you to go get a graphic, go Google image it or something, and it's at the end of the large intestine, and it's this little free floating little tail that's about the size of your finger that hangs off of that large intestine. And people who used to say for years, well, there's no purpose for the appendix and it causes problems, it gets inflamed, and you have to go in and have surgery, or it could burst, and cause all kinds of problems. So why do we have an appendix? Well, she was reading the other day, and she said they have discovered that it has supplementary what did she say? Supplementary infection control. So when your stomach is not able to do its job properly, the appendix has the reserve, and it will, not the stomach, the intestines, I'm sorry. It sends out the supplementary contents for the intestines. It was just go Google it. I'm trying to do it by memory. She was telling me, and of course I thought that was very interesting, but I was half listening and I meant to go and study it some more. And we'll share it, I'm sure, on one of our future webinars, but go look it up. So appendicitis, most people know what appendicitis is. How are we going to look up appendicitis in the index? Well, it's actually one of the easiest things to look up, because you just go look up under A's for appendicitis. That's it. And then it will tell you the code, the beginning of the code, and then you will go and look it up. So I actually have my index. Let's see if this is how we use the find a code. Has tools, which is kind of like an index. So here's the index search. If you're using an encoder, of course you can't do that when you're testing, but when you're learning you can. So this is going to have the exact same content that's in the index of the ICD manual. So I'm just going to put in a pin. I don't even have to spell it right. Okay. And then here are the different things: appearance, appendage, appendicitis. Okay. That's what I want. But there is also another type, appendicular appendix. That's not what I want. I know the patient has appendicitis, right? So I'm going to click on this because this is how you're going to be looking it up. You're going to literally go in the index. It's going to say appearance, appendage, appendicitis. Now, that tells us that to find the code, we want to look up K37. Now, that is where we go to our tabular. K37 is unspecified appendicitis, but actually, diseases of the appendix can be K35 through K38. So there's a higher specificity. The index, you never take the code from the index. You always go to the tabular and verify, because unspecified appendicitis may not be what we want, right? So I'm actually going to see if this will open up. My internet doesn't always work really quickly for me, unfortunately, where I live now. But let's look here and see if it matches the definition. Now, if it just says appendicitis on the documentation, then yes, unspecified appendicitis is the proper code, and we only need 3 characters, K37, okay? But this excludes unspecified appendicitis with peritonitis. So when I move to the tabular, and we're not going to spend a lot of time in the tabular because we're not teaching the tabular. I want you to learn how to use the index. That's our purpose today. But here are all the different things that could happen to the appendix. It could be acute appendicitis with perforation of localized peritonitis with abscess, unspecified acute appendicitis, K35.80, right? And other, or just unspecified. Okay. We want to stay away from unspecified if we can, but quite honestly, if it just states appendicitis, that's all we have to go by, and the code is K37. But chances are it's going to be K35.80. Most people have acute appendicitis, but anyway, that's how you look it up in the index. All right. So let's just move this over and let's look at our next. I want to save this so it doesn't open up in like 5 windows. Okay, next. Whoops. So let's get this over here. Diabetes mellitus, DM. Pretty common diagnosis. In fact, probably one of the diagnoses is, if you're taking a course, that you're going to memorize pretty quickly. We don't have you memorize codes, but when you use them repetitively, at least part of the code, you'll end up getting in your little gray cells. So now we get into the keywords. What's our keyword to look up? Are we going to look up diabetes, or are we going to look up mellitus? Do you even know what mellitus means? You know, everybody usually says diabetes, right? There's actually several types of diabetes, and there's diabetes insipidus, secondary diabetes, and some others. Plus, even within diabetes mellitus, there's 2 types. There's type 1 and type 2. And now there's type 1.5, but there's not a code for that yet. So again, keyword, we've got diabetes mellitus. Now, if you're brand new to coding, what are you going to look up? You're going to look up diabetes, or you're going to look up mellitus. So this is what you have to think to yourself. Whenever you think of things like appendicitis, it's one word. We all know what it is. It's appendicitis. Okay. But diabetes mellitus, 2 words. Is it diabetes or is it mellitus that we're going to look up? It's actually diabetes, because mellitus is a type. So it would be, think of it as an adjective. What does the patient have? The patient doesn't have mellitus. They have diabetes. What type of diabetes do they have? They have diabetes mellitus. And then we want to know if they have type 1 or 2. So the key word that you're going to look up is diabetes. And if you want to know how many there is, I'm just going to give you a quick look real quick. So we're going to go in here again. Let me just set this up, and I'm going to put in diabetes. And again, you don't even have to really be that great of a speller, because when you're doing this, all you have to put is the first few letters because you're going to do a drop down and be able to see them, just like you're looking at a dictionary trying to figure out how to spell a word. Okay, so diabetes mellitus, it says diabetes, diabetic, mellitus, sugar. Okay, and in the index, whenever you see anything in these parentheticals, it means that that's applicable to what you're reading. Okay, so let's just expand this. So if it's type 2 diabetes mellitus without complications, it's going to be E11.9, and that's where we're going to go. We're going to go look up that in the tabular. However, diabetes can be type 1 or type 2. All right. And so here's diabetes type 1. So we would click on that and it would take us, it would give us the choice. It's actually E10. Okay. But look at this with. With means that it has all of these other things that could happen in the diabetes. And so when you're looking at it's saying just diabetes mellitus, okay, no other information, you default to type 2 because 98% of all diabetics are type 2 diabetes, okay? So it's going to be E11.9. But let's say that that stated it wasn't just diabetes mellitus there. Let's say it was diabetes mellitus with CKD. Okay, so CKD is chronic kidney disease. So let's just go look with. So it's not going to be E11.9 because now we're not going to get into so much about the code set and how we use it. We're just talking about how to do the index because that's all another part. So we're going to alphabetically look for chronic kidney disease. There it is, chronic kidney disease. So it's not going to be E11.9. 9 usually means unspecified, 95% of the time, not always. It's E11.22. However, there's more there. Look, and as far as this is concerned, just know that the little green arrow just means there's an indent. Okay, it's going to, in your manual, it would be indenting. So it says we have choices here. We have E11.22, okay, which is diabetes mellitus with diabetic chronic kidney disease. Now, with that being said, let's look and see what, oh, wait, I hit the wrong one. I hit circulation complications. Let's just stop that real quick. While that's doing that, let me just get rid of the unspecified. Let me get rid of that too. Okay. So it may or may not load quickly for me. We won't spend a lot of time if it doesn't load quickly. Type 2 diabetes mellitus with diabetic chronic kidney disease. Now there's more information that we have to do, we have to know, but we pay attention to the excludes because if one of these excludes is applicable, that means we will go back to the index and double check, okay? So what if it's type 1 diabetes mellitus? Then remember I told you it was E10, okay? So this is how you look it up in the index. What if you just had, I saw gangrene there. We have diabetes with gangrene. Let's just look at that real quick. More information. Type 2 diabetes with diabetic peripheral angiopathy with gangrene. And that's what it means whenever you get gangrene, we're rotting. Something's rotting away, right? Now, a great thing about the index is it shows you the possibilities. So I like to tell my students, and I encourage you to do this too, the index isn't just for looking things up. It's also for making it, it's great for making you aware of possibilities. Look at all of the things that diabetes can be associated with, okay? All the way down to skin complications. And of course, diabetes type 1, or some people call it brittle diabetes, but polyneuropathy, osteomyelitis, oral complications, because quite honestly, diabetes is a disease that affects every organ system. Every part of your body can be affected by diabetes. And so that's why this list is so long. Neurological complications, nephropathy. Let's see, do you even know what some of these words are? Kimball-Wilson's disease. Maybe you don't even know, so you need to go look those up. If you don't know what hyperosmolarity is, when you're looking, you're saying, okay, I'm trying to find, diabetes with hypoglycemia. It's like, oh, wait, what's this word? If you don't know what that is, make a note of it in a little notebook. And I always tell my students, keep a little notebook with you so you can just jot down terms and things that you're not familiar with, so that when you have time, you can go look. So the index for ICD-10 is a fabulous way to increase your knowledge base, because all of this is listed, right? Did you even know gastroparesis? Yeah, what happens with diabetics, sometimes it affects the digestive system and it paralyzes or gives paresis, or here's gastroparalysis, but it's the same code. So it like paralyzes a section of the digestive tract. Did you not know that? If you did, that's great. Hey, if you did know that, comment in the index in the chat and let me know that you knew that. Or if there's something you ever found in the index when you were looking up a code that you didn't know what it was and you went and later researched it. So let's move on. Pulmonary hypertension. What are we going to look up? Now that is really interesting, because pulmonary hypertension has two key words. You could look up pulmonary and you could look up hypertension. Either one, and you're going to end up finding it in the index. What does the person have ultimately though? The person doesn't have pulmonary. The person has hypertension. What type of hypertension? And there's several kinds. There's essential, there's malignant, there's benign hypertension. Pulmonary hypertension is a very specific type of hypertension that involves the lungs, and it raises the pressure of the arteries in the lung, thus pulmonary. Again, it's not like regular hypertension where your blood pressure is advanced. It is raising technically the blood pressure of the arteries of the lung. So you can look up hypertension, but pulmonary hypertension is a unique diagnosis that if we looked up pulmonary, we could probably find hypertension. So I'm going to actually do that over here while we're talking, and let's see if we can get that to come up and see what comes up under pulmonary. Okay, this is what it makes you do. So if you go in and you look up pulmonary hypertension, it tells you, hey, go see the condition. So that's exactly what it says in the index. So if you go to your index in your ICD-10 manual and you look up pulmonary, it's going to say go see condition, right? So then you would look up hypertension and it would give you all the different types. So let's just give me tons of them. And here's what we got. Hypertensive urgency, see hypertension. Hypertension, and then it says all of these different types: accelerated, benign, essential, idiopathic, malignant, systemic. Okay, and those are not pulmonary, right? So let's actually do a drop down and see what we get. And then it says, hey, let's go look here. Let's see. Notice it's all alphabetized. Pulmonary. Pulmonary. So our starting point in the index is going to go to I27.20, and then we'll turn in the tabular and find it. So our keyword wasn't pulmonary, it was hypertension. Could you, if I had opened that up, it might have showed me in condition some suggestions. Okay, let's look at vascular insufficiency. What are we going to look up? Are we going to look up vascular or insufficiency? What does the patient have? They have insufficiency. What do they have insufficiency of? The vascular system. So the key word is insufficiency that you look up. What about when you see abbreviations like this? What are you going to do? Well, you need to know what PVD stands for, and COPD also. So PVD stands for peripheral vascular disease. And if you look up vascular insufficiency, you'll probably say, hey, different types of peripheral vascular disease. So what do we look up? Does the person have peripheral? Does the person have vascular? Does the person have a disease? They have a disease. What type of disease? They have a vascular disease. What type of a vascular disease? They have peripheral vascular disease. Okay, that's how you look it up, and you literally just keep indenting. COPD is quite unique though, because it's chronic obstructive pulmonary disease, and that's a little harder to look up. So let's just figure out how to do that. So most people say, well, we would look up disease, right? Because what does the person have? They have a lung disease. They have a pulmonary disease. So you look up disease, and it's going to see disease, see also syndrome, and you can click on that, and it will give you a cajillion different types of disease. So what does a person have? Do they have chronic disease? No, that's a descriptive word, right? Do they have obstructive disease? Yeah, it's still descriptive. They have pulmonary. Well, that's kind of descriptive too. So I don't think you can actually find it under pulmonary. Go into disease pulmonary. Now, I couldn't make a liar out of me, but my word, look how long this is. And literally, you're just going to run your finger, and it can be several pages long in your index. So here we go. Pulmonary. Do we have pulmonary? And it may tell you to go look up something else. Pulmonary. Pneumonia. Okay, pulmonary isn't the word. It's actually lung. You're going to look up disease and then lung. And most people don't know that. When they go to look this up, they get very confused. Students, they used to get kind of cocky saying, oh, I can find it, when you're first starting out. And then I tell them, go look up COPD. And then we talk about, is it chronic? Is it obstructive? And then they can't find it, but in the index, but it's actually lung. You look up disease lung. And so you go back up here. And so let's look up lung. And so that's kind of mean of me, but I want to show them that, hey, sometimes it throws you a, it throws you a curveball. So we have other disorders of the lung, but that's not what we have. We actually have chronic obstructive lung disease, right? So now it's going to find out all the types that are chronic and obstructive. Emphysema with decompensated and polycystic and so on and so forth. Okay, so again, that's kind of fun, but that's a little bit trickier. So let's move on. Fever. Well, you're just going to look up fever. Now you think, wait, that's not a disease, that's a condition. Well, it's true. Sometimes you code signs and symptoms for outpatient. If a person has a fever, you just look up the word fever, but there's a lot of different types of fever. So it's going to give you a long list. Same thing with N/V. Do you know what that is? If you know what that is, write it in the chat, because I would like to know how many people know what that is. I'll give you a couple minutes and we'll come back to it. Do you know what N/V is? The abbreviation for that is. And then let's go into hemorrhagic shock. What do we look up? Do we look up hemorrhagic or do we look up shock? Well, what does the person have? They don't have hemorrhagic. Now you can have hemorrhaging, but hemorrhagic is a description. It is a type of shock. So you're going to look up shock, and then you're going to look up hemorrhagic. Buerger's disease, whenever you have a disease that's named after somebody, if you have a capital, a descriptive word is usually somebody's last name, then you can look up disease and then look under the B's. But in most times, you can look up the word itself, and then if it's capitalized. So Raynaud's phenomenon and Buerger's disease are ones that you could look up phenomenon, or you could look up the first name. Do you know what N/V is? It stands for nausea and vomiting. So how are we going to look that up? Because that's two symptoms, right? Nausea and vomiting. Well, let's just go look real quick. Let me check and see how we're doing time. I get to talking here and I might just run. Okay, we're doing pretty good. We're going to look up either nausea or vomiting, because you can get there is a code for nausea with vomiting, or vomiting with nausea. Hemorrhagic shock, you're going to look up shock and then hemorrhagic. Oops, but I wanted to tell you an interesting thing here. Buerger's disease and this other syndrome is actually the same thing. So I want you to take some time to look those up. It's pretty cool that happens. So Buerger's disease is also this type of syndrome, Raynaud's syndrome, and I know what it means, but I'd like for you to look it up, put in the chat, and let us know. And even if it's after the webinar, come back if you're watching us, whether on YouTube, Facebook, or even on LinkedIn. Go in and put that in there, what it is after you do a little research. And if you can find the code, go ahead and code it out for us. You found it in the index. Let's move on to the CPT manual. We'll start speeding up a little bit because it's easier, and really we've more or less, once you know how to look up in an index, it's kind of the same thing throughout. Now, we're going to use an index for some different purpose. CPT is what we're doing to the patient. And again, these codes are used for reimbursement to say what we're doing to the patient, the treatment that the patient's getting. However, we do have to have an ICD code, a diagnosis, to back up, to prove that the reason why would you do an appendectomy? Because the patient had appendicitis, right? So you got to have both of that. You got to tell the whole story. You can't just go in and do an appendectomy for no reason. There has to be a reason because of appendicitis. How are you going to look up appendectomy? It's pretty simple. You just look up appendectomy. Okay, it's going to be in there. So actually what I'm going to do is move this over real quick, and let's just do that. So to show you how quick this is, I need to switch to my other manual because we've been looking up ICD, right? So now we're going to look up CPT, and keep in mind, CPT is a different manual, so it's what you do to the patient, not what is wrong with the patient. Okay, so let's look up appendectomy. Okay, CPT says appendix. Yes, we are doing something to the appendix. What can we do to the appendix? We can do an incision and drainage. Yeah, we can do a removal. So what is an appendectomy? It's a removal. And so that's our code range. Because you think, well, why is there so many codes for an appendectomy? You got like 20 codes there. Well, because is it going to be laparoscopic? Is it going to be open? Right? So again, we need more information to get to a higher specificity, and then we just go over to and it says this one is appendectomy, this one is surgical or laparoscopic surgical appendectomy. Okay, and then there's a bunch of codes in between. All right, I'm going to move that over here. Super easy to use that in. Now, how are we going to look up a glucose tolerance test? And I tried to match some of these with the diagnoses. What is the key term? What are we doing to the patient? Are we doing a glucose? Are we doing a tolerance? Are we doing a test? We're doing a test, but it's not really a glue. How do we look up glucose tolerance test? Can we just put in test? Will they let us do that? Well, let's just see what comes up. So with procedures, you really have to know what is the reason for the test. So look at all these tests. So now we're going to go, is it going to be looking up a glucose test or a tolerance test? It's probably going to be glucose. There you go. Glucose tolerance test. 82. So glucose, you have to know it's a glucagon tolerance test, glucose tolerance test. So what did we look up? We looked up test. What were they trying to test? They were trying to test the function of something. What's the function? The function. No, that's actually another one. See, there's all different types of functions. That's not what I wanted. So be careful with your indents. So are we doing a test for GERD? Are we doing a glass test? Or glucose tolerance test? Okay. Look, hamster penetration. You know what that is? Go look it up. So again, the index gives you a lot of procedures. Do you even know what some of this human immunodeficiency test? These are all tests, right? Monospot, see if they got mononucleosis. Okay, all of that stuff on the test, and I'm not going to go through all of those because there's a lot of them there. Okay, now this is another test, arterial septostomy. This is a kind of a rare procedure that's done to a patient who has severe PVD or really actually insufficiency, arterial insufficiency, and they go in and open up a opening between two parts of the heart and stuff like that. It's pretty rare. But what are we going to look up? Septostomy. Do you even know what a septostomy is? You probably don't. So ultimately, they're separating and putting an ostomy between the two parts of the heart. But we're not looking up arterial. We're looking up septostomy. So I'm just going to put that in there because I didn't look it up. I looked up I wonder if it even is in there under that. It is. Okay, so it's under septostomy, but it gives us this. So looky there, we have several kinds: arterial, closed heart, or open heart. Very interesting. So you got to have all of that information. Angioplasty. It's going to be under angioplasty. But if you don't know what an angioplasty is, you're going to have difficulty finding it. Now, I didn't want to put a whole lot of abbreviations in here, but an EVAR is it's pretty common. It's to repair an aneurysm. It's an endovascular aneurysm repair. So it has to be endovascular, and there are different places that you can have an aneurysm. You can have an aneurysm in your head. You can have an aneurysm in your chest, thoracic aneurysm. You can have aortic aneurysm. You can have several types. And so, what is the key word for this AVAR? EVAR. And again, they're not going to write endovascular aneurysm repair. They are going to put EVAR, and you need to know what it is. Well, what are we doing to the patient? We're not doing endovascular. That is a type of something. We're not doing an aneurysm. The aneurysm is what they have. What type of an aneurysm do they have? Endovascular. Okay. And then what are we actually doing? We're doing a repair. So you're going to look under repair. Okay. And then it'll say aneurysm. And then it'll give you all the different types, and you'll pick endovascular. A pulmonary study is actually under study, but you have to know it's a lung study. It's to do with the air. Strep test, same thing, go into test, just like a glucose tolerance test. You do, and strep tests are very, very common, and there's more than one type of strep test. So it's important that you get the code for the proper strep test. Flu shot, you're not going to look up shot, and you're not going to look up flu, because what is a shot? It's an injection. So the key word is injection. Okay, and then you're going to break it down from that. What about packing of nose for bleeding? What do you think the key word there is going to be? What's happening to the patient? They're bleeding. Where are they bleeding at? In the nose. Packing. What is packing? Now, if you don't understand the concept of what that is, and wounds are packed, okay, and there's more than one type of packing. So if you're packing a nose for bleeding, what they do is they open up this little jar that kind of looks, oh, I got this antique jar over here. It was found outside. Kind of comes in a jar like that, just not so vintage looking. They open up this, or it has a little opening, and then they have this, they just start pulling it out. It's like this little ribbon. It looks like bias tape. And so they start pulling the bias tape out, and they start shoving it up the nose. Shove, 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 shove. And you'd be surprised how much you can get in somebody's sinus passages. So they pack that in, and then they just cut it off and leave it in there, tuck it up in there. And that's packing. But all kinds of wounds there's several types of wounds that are packed, and packing wounds end up being something that it has like a hole in a crater that we need to heal from the inside out. We can't close it, because if you do this, if you have a wound like this and you just close it, then you're going to get infection buildup. Because what does our body do when we have a wound? When we scrape our knee, what happens? You get that clear serous fluid that as well as a little bit of blood, right? And that's all those white blood cells going to heal the area and prevent infection. Well, that's what happens anywhere in the body whenever you have any type of wound. So if you close that up, that's going to fill up with, and what happens in a warm, moist, wet, dark spot? You get infection. So they pack it, they fill it up on the inside, and they let it start healing from the inside until it comes together. So that's what packing is used for. All right, moving from CPT to HCPCS. People get really worried and frustrated with HCPCS. It's actually quite easy to work with, but it's not. They don't spend a lot of time teaching about HCPCS because, again, it's used for Medicare patients. You will find it on most of your coding exams, but even for like the AAPC for the CPC exam, you only get 5 questions, okay, for HCPCS. So again, they don't spend a lot of time on it. You look at the index the same way. The thing of it is there's a lot of different stuff in a HCPCS manual. It's not that it's that big of a manual, but it's not only is it supplies, but it's medications and so on and services that are being provided to the Medicare patients. So if you look up something like a wheelchair cushion, let's say our patient is a paraplegic and they need a wheelchair cushion. So what are you going to look up? Cushion or wheelchair? Well, actually, you could look up either one. So, but you're going to look up cushion, and then it's going to say what kind wheelchair. Pretty easy. Okay. And the wheelchair cushions come in more than one size. So you have to make sure you get the code for the right one. Is it a 10-inch or is it an 8-inch wheelchair cushion? Next one is tetracycline 250 milligrams IM. Now, most people know tetracycline is an antibiotic. Don't worry about the 250 milligrams, but it will tell you that it gives up to 250 milligrams. So if you're given 500 milligrams of tetracycline, then you're going to use that code times 2, right? You're going to use it twice because you're given 500 milligrams and it goes up to 250. It just happens to be for that code. But you have to know what it is. You can look up tetracycline, but you have to know that it's tetracycline, not tetracycline that we're usually, you hear people say. The 250 milligrams, not so much. You're going to look that up in the tabular part, but you have to know what it is. It's an injection. And so it's an intramuscular injection. You're not going to be able to find tetracycline. It's going to be under injection. Then what are you injecting? Tetracycline. Okay. So what do we look up for an antibiotic shot? Injection. You don't have to know that it's a muscular or whatever. You just have to know it's an injection. That's what IM stands for, intramuscular. Now I have sub-Q. They got all different kinds. Now, we talked about wheelchair cushions. We talked about medications and stuff. There are also codes for ambulances in there for Medicare. One of the ones that I looked up that is kind of unique was if you need an extra attendant on the ambulance, and it would be under, if it said, ambulance EMT, extra ambulance EMT, they needed to have somebody else come in. For whatever reason you're transporting, you need more than what you normally would. Well, how are you going to look that up? It's actually under transport. That's the key word. So you're going to look in the index under transport because that's what you do with ambulances. And then there's a whole bunch of criteria under that. And if you're going to look up transport, and then you're going to just go down transport, and it's going to say ambulance, and then it's going to say, is it air transport? Is it non-emergency transport? And then it'll say extra attendant ambulance, and that's A0242. So your key word is transport. Then what if you need to code for a person learning to cook an egg? This was pretty interesting. The keywords, I went to bold that, and the code is actually H2014. It's considered skills training and development, and they do it per minute, so 15 minutes. So if it took 30 minutes to teach this person how to cook an egg, it'd be H2014 times 2. But the key words, what is that? It's a rehabilitation service. So you're going to look under rehabilitation. What subcategory? Behavioral health services, and then it's under skill training. And that would be the code for learning to cook an egg for a Medicare patient. And you think, well, wait a minute, why are you even doing that? Well, what if a person had a stroke and it messed with their cognitive abilities, and then they're learning how to take care of themselves again? And one of the things would be occupational therapy. They need to learn to, cook an egg. Then you would get that. Good stuff. Now we're going to wrap up with HCPCS. I think we've done a good job of keeping this pretty even. We're going to wrap up pretty quickly. With HCPCS, again, the index is a little bit different, but The thing about it is there is still a key word, and the key word is the outcome of the procedure. Unlike CPT, where it's what are we doing to the patient? It's still what you're doing to the patient, but it's more than that. It's the outcome of the procedure. So I took just one word. We're going to do an angioplasty, okay? But there's several things that we can do within an angioplasty. What's the outcome? Now, a regular angioplasty would be like a dilation, right? And this is the root operation. So your first three characters are going to be your category, which for an angioplasty would be med surg, and then what body system are we working in, and then the root operation, which would be dilation. So if you go in and you actually find angioplasty, then you're going to have more than one choice. You're going to have angioplasty that does a dilation, angioplasty for a repair, angioplasty for replacement, and angioplasty for supplement. So that means you have to know what a dilation, repair, replacement, and supplement is. Could you use all of those? Yeah, you could, because if you understand how an angioplasty is done, the outcome, we dilate the vessel, right? We might replace part of the vessel, or we might do a supplement. So we may dilate and supplement at the same time. The other key thing that you need to know to get the highest specificity is, are we going to do an angioplasty to the heart and great vessel? Or are we going to do lower arteries or upper arteries? Now, upper arteries are considered, we're talking extremities. We're talking about the arms. Lower arteries will be the legs, and the heart and great vessels are in the thoracic area. So that's talking about your heart, and then the aorta, and then it comes down through the superior and inferior, stuff like that, vena cava, blah, 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 things like that. So vena, is it an artery or is it a vessel? And so angioplasty, what are we going to do? We need the outcome of the procedure. Are we going to do a dilation, repair, replacement, or supplement? Those are your choices. And then once you decide that, okay, we're going to do a repair, then you say, is it a great heart or great vessel? Is it lower extremities or upper extremities? All right. Then that's how you look it up in the index. What are you doing? I'm doing a dilation. What are you doing in dilation? Oh, we're doing an angioplasty. Where are you doing it at? Then you go lower arteries, lower extremities. So again, pretty easy, pretty fun. Once you get to using it, the index still push you with PCS, takes you to not a tabular, but a page of tables where you get to a higher specificity. It's a lot of fun to use. So wrapping it up, if this again is your first time joining us, thank you. If you're joining us on LinkedIn, that's a pretty new thing to be doing live streaming on LinkedIn, but we've been doing this for years now. So we're excited to be able to use that new platform. If you're watching us on YouTube or Facebook, don't forget to like and subscribe, as they always say, those fancy YouTubers out there. But know that in any of those areas, you can ask questions and we'll go and check them in. If you really want your questions answered quickly, or you have an idea for something you would like to have us talk about in one of our other non-student webinars, and we do several webinars a week, just go to cco.us and you can look at topic requests, or just go to cco.us. It's self-explanatory because the website is so user-friendly, and that's us. We go by cco.us, and we have a lot of fun. We really enjoy what we do, and we like giving you this free content. And let us know if you appreciate it, or if there's anything that we can do to help you with your certifications, obtaining your certifications, or getting CEUs. So thank you guys. Have a great rest of your day.